and welcome back to Healthy Living. In honor of National Kidney Month, we're here at the Guam Memorial Hospital to talk about kidney health with Veronica Cenzon and Redora Cruz. So for those in the community who don't know, what is the kidney and why is it so important for our body?
The kidney is one of our vital organs, and really what it does is filters all the toxins that we accumulate from our blood and from the intake that we take into our bodies. It's one of our vital organs that we must protect.
Okay, so is kidney disease a common illness here on island?
Kidney disease is more common here in the island of Guam because most people here are diabetes and with high blood pressure, diabetic type 1 and diabetes type 2. So in order for us to be not go to the kidney end-stage renal kidney disease, we have to take care of our body, especially we have to take care of diet, and then we have a frequent annual checkup with a doctor.
Okay, so what causes it? So you mentioned that it's pretty common here on island. What causes kidney disease?
Usually, the most common cause is the diabetes and type 1 diabetes and type 2 diabetes. Plus, if you have a high blood pressure, that's the common cause of kidney disease.
Okay, so are these genetic factors or are these more so lifestyle factors?
It can be both. So if it's related in the family or it comes in the family, then it can be genetic. It also can be how what we eat and how we lack of exercise and things like that. So it can be both genetic and lifestyle.
Okay, so we're here at the Guam Memorial Hospital right now. I know you guys both work in this field every single day. So can you tell us, for those who reach, who end up having kidney disease, how is it treated? And can you tell us a little bit about where we are and what you guys do?
If you are end-stage renal disease, you have to be end up on the dialysis treatment. Otherwise, if you are still young and if you are capable of getting a kidney transplant, you could get a kidney transplant to prevent more, to give prevent more further kidney injury to our body.
Okay, so for people who don't know, it's really common here on island, so a lot of people know someone who's on dialysis, but for those who don't know, what is dialysis? What does it do?
I think she could answer that more. She's on dialysis.
Dialysis, this is our kidney machine, which there is like a kidney, artificial kidney, which is gonna be set up on this machine, and the blood that comes out from the body gonna filter here in this very cute kidney, artificial kidney. And then once the blood is filtering here clean, it gonna goes back to the body system. It's a very complicated kind of treatment to the patient, but it helps. It prolongs life. It's not a treatment, but it prolongs life of the patient.
Is there anything else someone can do? Is that the main treatment for kidney disease? Is there any other lifestyle changes they can make?
We still have that CAPD, continuous dialysis catheter, CAPD. They introduce a catheter in the stomach and the peritoneum, and then the patient will be the one to do it every 4 hours. But they can do it at home setting, and then family or the patient can able to do their usual activities.
Okay, so it's definitely really important to keep your kidney health to try to prevent this from happening. So can you give us some advice, some tips for people in the community? How can they keep their kidneys healthy?
In order for us to be keep our kidney healthy, we have to stick to our good diet, exercise, and we have that annual checkup with a doctor. And especially, you have to be compliant with our medication, blood pressure medication, so that we will be able to maintain those this level of blood pressure parameters. Once our kidney is damaged, it's gonna be like it gives more injury to the kidney, so it's gonna be end up to a dialysis treatment.
Okay, so say you're not really sure if you might have some kidney problems. What are the symptoms, and how can you find out for sure if you do have kidney disease or any kidney problems?
Wow. I mean, what Veronica's saying is you really need to do that annual checkup with your physician. The blood work alone can let them know whether your kidneys are failing or is about to fail. So with that annual checkup, they can start early as with just medications and just like diet and exercise and try to prevent the long-term chronic dialysis. So that annual checkup with your physician is very important.
Okay, and finally, just to close it out, why are our kidneys so important, and why is it important to keep them healthy?
A lot of times, Veronica is the dialysis nurse. I'm an ER nurse by trade. But really, when we learn about dialysis, it's something that's long term. A lot of patients can go into depression because they really have to change their lifestyle to come and to get their treatment every other day. And it's really something that, a lot of us don't want to get into because you really just to stay, and it's like 4 hours. It's a 4-hour treatment. So that is, just to think of that machine, I think it'd be best to just try to prevent it in the first place.
All right, thank you, ladies. Really appreciate all the work you do here at the Guam Memorial Hospital. All right, well, stay tuned. We'll have more healthy living after the break.